Thank you. Thank you, Jinbar. So yeah, so for I believe most of you may be familiar with my association with Global Institute of Public Health, where I was a part of the initial team which um, launched the institute along with um, with some of the colleagues who are still there. Um, mm, we Now I am currently with the Boston University, but I'm also on roll with as in the faculty list of the Global Institute, and I support some of the work going on in the institute. Just trying to hide the floating control. Okay. So today we will spend some time, next maybe 40 minutes, to discuss like how in public health research we can conduct a literature review in a very systematic manner. And I see this as a very in a discussion format, and I encourage students to ask questions, stop me at any point of time, and or maybe put comments in the chat box so that we can take it up, and Jinbert can have a look in between so that we do not miss them. I hope I am recording this session, so I can share it also later on. So why do we need to do literature review? So do any of you have any idea of like why should we be doing literature review in public health in particular?
To get an understanding of what have been done till now and to follow what is already published.
Very good. So to understand like what is known to us in a particular field. Yes. Anyone else?
Dr. Anju has said, to identify the gap.
Yes, exactly. So one of the main purposes that we do literature review is to identify the gap so that we can start working on that area to fill that knowledge gap. Exactly. Then from a public health practice perspective, what is the importance of doing literature review? So
to know the persons who are expertised in this field.
Sorry?
To know the persons who are expertised in the field.
Yeah, to identify people who are working in this area, because if you want to identify to work with someone else, for example, if you have an area of interest and you want to maybe pursue a PhD or a training under someone, so you want to see like who has published in this area. So that's one way of understanding an expertise is to see like how much they have published. One way, one of those means. Get research ideas in the program public health sector. We also use a lot of review of literature in program development, to get gather ideas and evidences for program design. So you cannot design a public health program without any evidence. So you have to generate that evidence, for which you have to do systematic review of literature, including meta-analysis. Then we also need literature review for program evaluations and reviews. To understand whether some program is working really good, we need to see the studies that have examined those programs. We also need, particularly for funding request and grant applications, we need to have literature review thoroughly done. And of course, to summarize the knowledge, we also do something beyond systematic reviews. We also call meta-analysis, which is one step ahead of systematic review. We will not go into the details of systematic reviews or meta-analysis in this session, but this is broadly I would say a primer to like how we can conduct literature review, why it is required, and how we can do that in a basic research setting. And when we write literature review, this is often a challenging task, especially in the early days and years of career. When you write the literature review, your idea is to help the reader understand what are the knowledge and ideas that are established, and what are the strength and weakness of the evidence, and what is the gap. So you should be very careful when you write your literature review for your dissertation, or when you write, for maybe a proposal. No, it should not be just a descriptive list of materials available. It should not be just summary paragraphs from each paper. That is not literature review. That is something else, which is known as the annotated bibliography. This is quite a challenge. Many a times I have seen students writing, when we ask to do literature review, they end up writing annotated bibliography. So in bibliography, you are like each paragraph, or you write one paper, then one paper, then one paper, summarizing them. But that's not expected. That is not what is expected in literature review. A literature review should be synthesizing the evidence. So for that, you may take different approaches when you synthesize. For example, if I am doing a particular infectious disease in India, I may broadly start to look into the broader burden of diseases, then the infectious burden in the country, then coming to that particular disease. So that, and then under the particular disease, we may look into literature on epidemiology, literature into cost of care, treatment availability, public health importance, things like that. It's not that I do select one paper, write about it, then another paper, write about it. That's not literature review. This is often a problem that I have seen. So this is something which you should be very careful about. You have to synthesize the literature. For this means it's not an easy task like doing annotated bibliography. You cannot just write, find out some paper, summarize it and keep it. Another paper, summarize and keep it. That's not literature review. Okay. So as I said, in literature review, in each body of the literature review, there will be multiple papers cited. So you read like 5 or 7 papers which talks about the same concept or the same construct. You bring the evidence from all these 5-7 papers into 1 or 2 paragraphs, and then go to the next section where again you will summarize evidence from 5 or 7 papers into 1 or 2 paragraphs. Some of these papers may get repeated, but you will never have written one paper, the different constructs from one paper into 1 paragraph. That's not literature review. So where do you get started? Of course, you will start with an area of your interest. Usually, sometimes you will be, you will have to work on some areas where there is funding, where there is already some work going on. So you want to work with the team, or where you have got received some grants, or say PhD grant or something else. So it's basically, it is decided by your interest, the area where you're working, or maybe if you're working with an organization, the organization will have its own priorities. So you may be doing a review of literature for that particular area. For in your dissertation case, definitely I believe most of you will end up doing something of your particular personal interest. So identify the area, and in that particular broad area, you may have to now identify what has been done already. So once you know broadly about the topic, what is happening, what is it all about, then the next step is for you to understand like what has been done so far, and what may be some of the potential sub areas where you may be able to focus, given your time limits, given your resource limitations, given the limitations in terms of availability of supervision, or expertise among faculty members, or other resources that you may need. You may want to restrict yourself to some of the sub areas. And also, this is something again I would strongly advise that even if you identify a major area of work where you are interested in, you also try to understand what are the related areas, so that you can bring up, you can think of research which extends to multiple scientific domains. For example, if you are interested in a very particular medical condition, but then you are also interested in the social aspects or sociological aspects or psychological aspects of that same particular medical condition, then you will also have to read about the social science literature related to that disease. If you are interested in the economic aspects of a particular medical condition, you cannot just stop reading just the medical literature. You will have to read the economic, papers from economics and related subjects to understand what are the related research, so that you finally can end up identifying a question, a research question, which is most suitable to your interest and which is perhaps feasible given the time limits. And this is the overlap that I was mentioning. So that you can actually start or develop your skills in more than one areas of public health, public health skills, so that you get to learn some skills in economics or sociology or social sciences, plus you get to learn more about maybe public health or epidemiology of that particular disease. Always have your notes, go through them, figure out like what is emerging. It's not something that you will be able to do in just like a matter of a day or 2 days or 1 week. You may take a few days to figure it out. As I mentioned earlier, like in the case of example of the infectious diseases, when you write the literature review, you can have this approach as well. The broad issues, then narrowing down to what particular area of research you want to go to. For example, if someone is working on HIV/AIDS, they may want to write broadly, start broadly with the public health challenges of HIV and AIDS, starting from the 80s and 90s, and how it evolved and how it changed over time. Then you come to maybe particular challenges of HIV/AIDS, say related to injectable drug users. So maybe then that is your next layer of literature review. So after your initial 2 or 3 paragraph on the broad HIV/AIDS thing, which will bring multiple papers from different streams, then you will start focusing on, then you will say that injectable drug users are a particularly vulnerable group for HIV/AIDS because of particular reasons. Then the next in a couple of pages will be on why injectable drug users. You bring in literature on HIV/AIDS and injectable drug users. So that's a next, you are going down that pyramid. Then after that, after the injectable drug users, then you may want to further go down, maybe like injectable drug users in some particular settings, homelessness and injectable drug users, for example. People who do not have a family to live with and who has the issue of injectable drug use. So that's a more particular vulnerable group. So you want to look for literature now on that particular group. So basically you're narrowing down to a research question. And in that process, you will be identifying the research gap that you want to work on. So you should know that in any research, especially your master thesis, the most time consuming element is not your data collection or analysis or anything. It is your review of literature. If you have to have a quality product at the end of the course. So spend time, revisit your questions. The initial broad readings will help you to identify the broad area of research, what is happening. But then once you have that fairly, you will have to go for more focused search and focused reading. So always keep track of what you are reading. When you come from the broad area to the narrowest literature, you have to have a very focused, because you cannot leave out anything that you have read so far. You have to arrange all your references in a particular place where you can always go back and read it and review it. So I strongly encourage all of you to really get skill in using at least one of those reference programs. I personally I prefer Zotero for a lot of advantages, because it's mostly because it's an open source software. It's free. It gets updated. You get a lot of support online. So I prefer Zotero, but people can use different other programs. Programs like Zotero allows you to take notes, allows you to actually take or annotations and keep your notes ready. And you can easily transfer them into a Word document later on. So that will help you to not to have all the documents saved somewhere, you're missing those documents, you searched some date, it's lost. So it's always good to use some of those programs. And again, this is not a prescription. You can use different approaches. This is what I find very useful. Again, now you have a lot of resources. Definitely you feel compelled to use every resource available, but then you should be using resources wisely. You have to be mindful of the time, and you cannot just let yourself wandering around in the literature. You have to be focused. After the initial round of broad reading to understand the basic concept of a particular disease or a condition or a social condition or a social issue, then your readings should actually get focused. Here comes the role of using some of the databases like the PubMed, where you will be able to narrow down your readings. Unlike, say, example, Google, Google will throw up anything that you will ask. So, you cannot, it will be a never ending process. But if you go to, particular scientific literature databases like the PubMed or Web of Science or Embase or Scopus, you will be able to narrow down your questions and search, which will help you to maintain your time and resources, in a way which is helpful for you. Don't overdo things. You have to have an idea of like how much you want to write in the end. This particular point is like more in the initial stages of your reading. Like, when you start just initial reading, you may go for a wider reading, but then once you get a fairly good idea of like what is happening, you can stop that reading, and then you can go to a very focused question at that stage. And in particularly for dissertation, your interest in the initial phase of review of literature will be to identify your research question, and then subsequently your methods. So first you start with broader interest area, then identify maybe particular gaps in the literature which are feasible for you to address. So this will help you to figure out your research objectives. And then once your objectives are identified, then you can do a focused search to see, okay, how I can answer this research question. What are the methods that can be used? What are the paradigms that can be used when I am trying to answer this question? So that will be the next search of this. Then you have your, developing your tools. You will use the research question. Once you develop your tools, you go data collection, come back, and with your results in front of you, then you will again revisit the literature, and then see like what are your findings and what the literature says about the same things that you're finding. So like, you will do multiple rounds of reviews of literature in your dissertation process. And right from the beginning, before identifying the topic, once you identify the topic, identifying the objectives. Once you identify the objectives, then identify the methods which are suitable. Once you identify the methods, then identifying the questions and the tools that can be used. Then once you collect data, come back, analyze. Even for analysis, we always review literature to identify what are the methods of analysis. And then once you have the writing, your results in and writing, that phase again, we have to compare your results with the existing findings in the literature. So these are the multiple instances where we will be using literature review. There are different sources for searching literature. I'm not so sure like how many of these are accessible for you. Google Scholar, everyone can access. PubMed, everyone can access for sure. Embase and Web of Science, I'm not so sure. Maybe there are some facilities under the Kerala Health University now. So if there are such facilities which can be used, definitely use this, because at least especially when you are thinking of doing a very systematic review, definitely you need to do at least in minimum 2 or 3 databases before you say that you have done enough review of literature. So that's very important that if you are doing a systematic review, you should at least have reviewed 2 or 3 of those sources. So are there any questions till now? Is it all clear what I have been discussing? I will stop here for a few minutes to allow some questions, or especially, I want you to be very clear, like why you do this in your context. That is to identify the research questions, the gap, and, and also like at the end of the research, how you can bring in again the literature. I will stop here for a few minutes.
Dr. Shafi, just one question from the slide which is being still shown. So when we look for literature in PubMed and Embase, will it be repetition, or those are totally exclusive? Like,
Okay, that's a very good question. So, so after we review the literature, in the sense like, this phase is like searching the sources. So once you search the sources, the next step is actually to, the first step is to deduplicate the sources. As rightly said, many of these papers will appear in all these databases, but then there are ways to deduplicate it very easily these days. Things like Zotero can do it for you, but like it's a bit manual process. I mean, it's not manual, but it's like, if for example there are like newer open programs like Ryan, for example, Rayya and Ryan. So Ryan is an open online. So I will show it if time permits. It helps you to bring your results from PubMed, Embase, Web of Science, everywhere to one place in Ryan, and then Ryan can actually help you to deduplicate it much easier. It uses some artificial intelligence to tell you that these are the potential duplicates, but then you will have to just run through it manually very quickly, because it's already identified and ordered. So you can just do it very quickly to deduplicate. So finally, when you write a review, especially when it is a systematic review, you cannot have duplicates.
thank you.
So do we have access through Kuhas to any of the other things, like other than PubMed?
No, I mean, nothing. I don't think so, unless, I mean, maybe I have to find out. I mean, as of now, I have.
It will be good to see if there are something, because I think Kuhas recently have been, I was reading somewhere, maybe there are, maybe, because all India level, there are universities having facilities like this.
Yeah, correct. I mean, we had a circular saying that, some things are moving on this direction. I don't know whether this is done yet.
Okay.
We'll find out.
Okay. So Medline has been in existence for several years, and PubMed is basically an extension of that. So in PubMed, you will find more than what is there in the Medline. Medline, it's both are like US. PubMed, Medline are all like US based databases funded by the US government. Embase is an equivalent of PubMed, but it's like more of a European focus. When we and also like, in countries which are like former colonies of the European countries, they also will have a lot of publications you will find them in Embase. So if you're doing a review of literature in Indian context, you will find a lot of papers in Embase. And also Web of Science. Web of Science is more interdisciplinary, as I mentioned in the beginning. If you are trying to bring research from cross-cutting themes, I strongly encourage you to use Web of Science facilities, because it's like it brings a lot of paper from different streams. Beyond these, there are specific things like, for example, Cochrane Library, which will help you to identify the systematic reviews in particular focus areas, which is a good starting point. Systematic reviews, as you know, is like a synthesis of existing literature. So that's a starting point. If I am going to read if I am going to start working on a new area, my first priority is to go and read one of the recent systematic review, because then it will tell you like what is the whole landscape of literature in that area. That gives a very fairly good idea of like what is happening in the research world. So systematic reviews are very good starting points. Then there are Scopus, Google Scholar. Google Scholar is free. Then JSTOR. Then there are like specific country specific and condition specific sources. For example, PsycInfo is a search base database where you will find all mental health related papers. PsycInfo. Then I think we also have in India a UGC supported program which actually collects all the university level theses and dissertations in one place. It's free to use. So that is also something which students can definitely use. We depend on journal articles because we believe it has undergone peer review, and therefore there's a minimum quality of information that is guaranteed. We know there are different types of papers: original research, review articles, systematic reviews, commentaries, and letters. So systematic reviews and meta-analysis are sort of high quality because it brings evidence from different or several articles. It's not like one set of authors. They have reviewed papers written by several authors. So that is a more stronger evidence. Then narrative reviews are a bit different, may not be so systematic, but still useful, especially if you want to have a broad idea on a completely new topic. Then of course, original papers, when it comes to specific questions, when you narrow down, you will go to more original papers to read. PubMed is most commonly used, and maybe we will focus something on PubMed now, identifying the key concept for your search, preparing your search, and then how many of you have used PubMed before? How many of you have used PubMed before?
Scholars, you can unmute.
Yeah, you can unmute. No problem. Mostly everyone has used. Yeah, okay, that's good. So in PubMed, we can you see? Okay. So in PubMed, we use different Boolean operators, which are the words and, or not, to identify and combine things that you want to search. And you can search in different areas, in the title or abstracts. There are like, these are called the field codes. The field codes help us to tell PubMed where to look for the words that we want to look for. And then there are filters. You can use the filter functions in PubMed to restrict the results that you get. For example, you want to say, PubMed, give us only where we get full papers free of cost to read, or give us only studies which are in the children, so that age group is restricted, or only papers from this period to this period. So this is possible to do this using the filter function, and we will see some of these things when I'm trying to show this, maybe some of those things online. I'm sure you, from my understanding, you know how to use it, but still maybe let me share this with you. So can you see?
Yeah.
Okay. So this is how PubMed looks like for anyone. I'm sure I'm told that most of you have used it, so it's not surprising for you. So usually we, for example, if you want to work on diabetes, if you want, in the beginning stage, when you say want to study something broadly, when you type something, it will actually show up the most common things. Maybe it is diabetes mellitus, and then I want to study on Kerala, and maybe I want to study on Ayurveda drugs. I put what are keywords I want. This is how you start with. Normally, this is how you start with. But then, if I am a bit more advanced user, I will first of all go to the National Library of Medicine. And if you here, you will find it has not just the PubMed, it has several things here. So I will go to MESH. So MESH is basically the collection of the terms that is linked to all the articles saved in PubMed. So here I will come and see diabetes. So if I just type diabetes, because this, once you search in the mesh, you will understand what is the correct term to use. So if I just put diabetes in this, you will find there are like different diabetes mellitus insipidus. There are different, and each of these terms are key terms used by PubMed to indicate particular things. Okay, so if I want, I'm using this is diabetes mellitus. So if I click the diabetes mellitus, it will show me what is diabetes mellitus, what is the definition, and then there are something called subheadings, if you see. So after a while of your initial search and reading, you may want to focus your search. So that point of time, it will be helpful to use some of these subheading options. For example, in diabetes, and if I want to use ethnology, so it will come like this: diabetes mellitus and ethnology. So that will be a mesh term, which is a focused subheading mesh term. And here also you will see, if you go down, it shows the tree, how this diabetes mellitus is organized as a tree form in the whole system for PubMed. So where diabetes comes under glucose metabolism disorders, and under the diabetes there are different things. So it appears in different places, and it has specific key terms associated with it. So if, for example, if I do like this, if I add to the search builders and search the PubMed, so I get something like this. So this is about these are like diabetes related topics with ethnology as a subheading. So, and then it has some 7,000 results. Now I want to do this more from a Indian context. So I will put, once you have this, I may use one option is to go to do advanced and go ahead and do it. But I will show also in a different way how to do it. For example, if I want to do it in India, in the mesh, I will put India. So if I put India and search in the mesh, so this is the term that we are looking for, India, So this India it shows, what is this place, what is it about, where is it, and, things like that. So, so one way is to search, basically start your search by proper key terms from the mesh database. So where is it more useful? In simple terms like diabetes mellitus and using the country name, it will not be much of usefulness. But for example, if you want to study something like, say, depression. So if you take depression, and you will find there are like different words of depression in PubMed having different definitions. So suppose if I click the first word depression, you will find here there are something called the entry terms. So why these entry terms are useful is, when we search in PubMed, we just do not search only with the mesh term. We have to use the relative terms, which will also imply or give you results on depression. So if I am using a mesh term, and if I am expanding my search later on, I will use some of these words also, because that words will give me more results than just using mesh term. And these terms can also be helpful when you are searching in another database, because you are using some structured words in your search. So this is why we can use mesh initial phase to identify the actual words that you want to use in your search. So now let me do come back to diabetes. So I use diabetes, add to the search builder, and Kerala, sorry, India. So it shows now, it is creating that. If you see here, it creates, it will build the things for you. And maybe I want also to search here itself Ayurveda. I don't know whether we have a term, it should be there, I believe. So if I text for Ayurveda, so this is the term that comes in, medicine Ayurvedic. It's not a mesh term, but it is the term that is used. So you can add to the search. So here itself, you create it in a way, diabetes and India and medicine and Ayurvedic. This is how it looks like. So now if you add and then search in the PubMed, it is really looking for these words, diabetes and India and Ayurveda medicine. All these are like mesh terms. So this is how we search. And now once we do this at the first level, then we can use an advanced option. When you click the advanced option and come here, and if you see the details, it shows how it is formed. And you can edit this later on. For example, I want to edit this, so I can add this to the query. And instead of India, I use Kerala. And remember the slide that I showed where you can use text words, title and abstract, all those things. You can use some of those things and then, come here. So we are getting like 2 papers here in this, which is on diabetes as a mesh term, Kerala as a text word, and medicine or Ayurvedic. So this is how we narrow down, narrow down to what we, how do we do the search in PubMed? So it is interesting to do some sort of up and down work before you actually finalize your search, so that if you are getting too little results, you want to go widen the results and see what is happening. So you will find more results, more papers which talks about the subject. And here you can again restrict the publication years simply by dragging this bar. You can use for free full text, which will give you papers which are available free of cost. You can just restrict it to systematic reviews, and then it will show there is only 1 paper on systematic review on Ayurvedic treatment for diabetes mellitus. You can have restricted to the last 10 years. So there are no papers on systematic review in 10 years. But if you just take the 10 year from 144, it came down to 16. So you can play around and see like what works best for you in terms of identifying your papers. And then I'm sure you're also aware that you can actually save the results. You can save the results on all the results on this page, all results and etc. You can save it as summary text, PubMed, CSV, abstract, everywhere you can save it in your files. I would strongly urge to save it in your citation manager, because then that will help you to actually bring them to your Zotero file. So once you download it, I'm not so sure whether you can see it. I will share the full thing so you can you see it now?
Yeah. Yes.
So you can save it, in a place, I will show it again. So if you send to citation manager all the results and create a file, it can be downloaded and somewhere saved. And once you save it and download it and save it, you can actually open with your own reference manager. So it will allow you to export it to your reference software. So all of these things will come here. And here you can read the papers, you can make your notes, you can add your notes, you can copy paste from the paper, or you can keep it, and you can later on export it to your Word document very easily. So this is how we can use PubMed. There are a lot of things to use in PubMed beyond this what I showed. There are like this filter option is a very good one. NCBI filter option is a very good option to use. You have to have a login ID, which may be either your ORCID ID or your probably Gmail. And ID, the best thing to have this account with National Library of Medicine or PubMed is that these results you can save within your online system. That will be helpful. Tomorrow, if you want to come back and use the same search string and run it again by just some small modification, you don't have to remember everything or copy and paste and save everything your search results. It will be here. You can come back here, and you can directly from here, you can restart your search from the previous day if you save it here. So that is why I encourage to have this one. You can have your own filters, things like that, and you can select your own ways of searching the PubMed. So yeah, you can actually create your filters even here, and keep it ready. Another thing is like I want to show is so any questions here?
In the search, while we're searching for an article, you said measured is on the topic, but the text word, you said that word would be on the title, or it can be anywhere on the article.
Okay, that's an interesting question. So if you go here, so if this is the place where you can find it. So if I'm showing you again how it comes here. So if you go to advanced, these are the fields that I was showing in the PowerPoint. These are the field. You can select where to search for. So this text word is TW. If I select text word, it actually not restricted to title and abstract, but it also search more widely. Okay, it is not like the normal. Simply, if you type Kerala and diabetes, that result is different from if you put text word. So it is a better way of searching that librarians advise. Even in our library, they advise to use, they advise 2-3 things. One is always have a mesh term in your search. If you are using PubMed, definitely the mesh term of that particular concept should be there. After the mesh term, I showed you some of the other terms. When we search the mesh term, we find some other words. Those terms should be there. And those terms can be used within the text word option. So for example, if I am using here, diabetes, this is not complete, but I'm just showing it. So if I am using, mesh term, I will use mesh term for diabetes. Okay, diabetes, and I will use text word for diabetes. So even if it is not a mesh term linked to a paper, if the diabetes appear as a text word, which PubMed has its own definition for text word, it's not just like that it's appearing anywhere. And then, for example, it avoids appearing in, for example, in bibliograph. It will avoid if it is appearing in, some of the unimportant sections, in the document file. So if I use, I will use a combination of mesh terms for the particular word. I will use and I will also add as text word those terms which the PubMed has shown you when you selected for that PubMed for that particular word. So this is text word. If I want to restrict it only to say title and abstract, I will use this word. So I will use diabetes here. This is just adding to the title. So that will be a different result. If I have asked for only the word only the diabetes in the word title abstract, I get only 189,466 words. But if I ask in text word, maybe it's different. Let me see. So instead of title abstract giving us 189,000 results, in text word I get 197,745. You know, but this will be different, I believe, from just searching for the results. In most cases, it is different. See, so I'm just searching diabetes. It gives me 2.56 lakhs. But if I'll show you here. So if I search just diabetes, just simply free full text, it is giving me 256,000 results. But if I use diabetes and text word, it gives me only 197,000 results. And if I restrict it to title and abstract, it gives me 189,000. So this is the difference. So librarians usually advise to use mesh term plus the same mesh term and its related terms as text word. Unless and otherwise you are restricted by time, you can search only in the title and abstract. Title and abstract is not an efficient way of doing it. You will miss a lot of papers. So it's good to use a combination of mesh terms plus text word options in the search.
Okay, thanks.
Briefly, maybe I will show you Ryan. So how many of you have used Ryan?
I
So
think
most
nobody.
of us.
Ryan also used. Good.
Okay, very good. So I mean, it makes me easy. It is easy for me. So Ryan has a lot of options. You know, there are a lot of reviews happening where you can go and use those data. There are, and you can create your own reviews. You know, you can create your own review by you know, giving the name of a review. And you know, nowadays they ask you to see like what are you going to do with this. You know, some more features have come. Then you create it. Once you create, you can select the files. So whatever files you have saved from PubMed or wherever, you can bring it here. All the papers will start to appear here. So you see all the papers coming here. So the first process, once you do this, is to it gives some time, and then you go for detect the duplicates. So once you click the detect duplicate, it will start to show whether there are duplicates. You know, there are, in this case there are no duplicates because you know, you remember the search, it was only in PubMed. I didn't do a search in another place. So but if I bring files from PubMed and Web of Science or somewhere else, and then bring it here and then do the search, it will show duplicates, and then you can actually remove the duplicates very easily. And then you know, it's, and you can also do you know, invite people. For example, here if you see duplicates, detecting duplicates, if I'm detecting duplicates here, this is some other work we were doing earlier. So yeah, so it will be showing, you know, not duplicates. It had some duplicates which were resolved, which were resolved. And then you can do the undecided, where you can go and do the screening. So basically Ryan helps you to do screening very easily. Also, I'm not so sure whether you are familiar of this Abstractor. Abstractor is also a program which helps you to do the initial screening very quickly, to identify papers which are relevant and exclude papers which are not relevant. This is again a free program. I also you know, suggest you to try using this thing. It's again, it also has an improved artificial intelligence component which helps to screen papers faster. So this is another program that is helpful for systematic reviews and even for normal reviews that you want to do. Yeah, maybe I will stop here and maybe we can have some questions, doubts, or any practical questions that you may have. Thank you.
Sir, actually the whole concept of mesh term, that's still not clear for me. See, if you're using a text word, you said it'll anyways pick up anywhere if that word is present anywhere in the whole document. Then why do we need some other term? Like, why should we include another filter there? if it is already picking up this word from anywhere, even from the least important part of the book.
No, TW will not pick from another where. It will not pick up from a least important place. So text word is so when we use when we do a search, for example, on a particular topic, first we try with mesh terms. So with the mesh terms, you will see that in many cases you will get very few results. So that is not helpful for us to do a review in many cases. A very comprehensive review requires you to have sufficient number of papers. So when you see that that is not coming up, then the next step is to expand your search. To expand your search, how PubMed organizes the paper. Based on how PubMed is organized, the PubMed is a library, right? It has organized its papers in a particular way. So therefore, the PubMed system advises users, because they know how they have organized the papers. They suggest that if your mesh term itself is not giving you sufficient papers, the next step is to use the same mesh terms and take it out of the mesh and use it with text word. Okay, so only the mesh term is coming up, or an article will be attached to a mesh term only if that paper is classified by the librarian in PubMed to be categorized under the mesh term of that particular word. For example, diabetes. If I am using Ayurvedic medicine as a mesh term, so only when the librarian feels sufficient that this article should have the mesh term Ayurvedic medicine, it will be linked to that Ayurvedic medicine mesh term. So because they manually do it, it's a manual process. So if the librarian, when he was assigning the mesh terms to those papers, he felt this is not something which is very well linked to Ayurvedic medicines, he may not attach that mesh term to that particular article. Therefore, if you use only the mesh term, you will miss that paper. In that case, you have to use a related term and search for more broadly to include that article. In that process, if you just loosely use it, you will get thousands of papers extra. So to avoid that, a midway that PubMed librarians and university librarians advise is that start with mesh term. If you find it's very few papers, then go to add that text word option in the search, so that you have the mesh term. All the papers attached to the mesh term will be picked up. Now, if there are some papers which the PubMed hasn't tagged to that mesh term, it will be picked up by using the word TW. So that is the second layer of gathering more papers. This is based on how PubMed organizes the files in the backend.
Thank you, sir.
Any other questions or comments or suggestions, or any other methods that someone has found to be very useful when you did the work? You can please share, so it's useful for everyone. Okay, Jinbert, any?
Yeah. Thank you, Dr. Shafi. We really appreciate your time. And as some of you are new here, I mean, Dr. Shafi is kind of very instrumental in starting GAPH. He is with us from the very beginning. And he has recently completed his DRPH from Boston University and produced a very highly appreciated paper in Lancet. And also, I mean, you are the right person to talk on this topic. So we really appreciate your time, and thank you so much.
Thank you, Jinbert. It's always a pleasure to be with students and colleagues from GIP. Thank you, Chitra, for joining. Thank you.
Shafi, I just wanted to sort of, how do I say, you are like God sent at the right time, because they are writing up their proposal, and it's like it's very, very, very helpful. Thank you so much for
Correct,
taking
yeah.
time to talk to them.
Yeah, it's a person. I was asked by Nair sir and Gilbert also like some time back, but today also, rightfully, I mean, that's yesterday I messaged him, if it's possible today, because today we have a holiday, without thinking, we should not think about holidays here, but suddenly it's a holiday. So I thought I will be staying back at home. So let's do this. Okay. Okay.
Yeah.
Thank you.
Thank you so much. Okay,
Thank you.
thank you.
Thank you,
Bye-bye.
sir. Thank you so much.
Thank you,
Take care.
Naik sir. Thank you, Jimbat, and thank you
Thank
special
you.
to Shafi. And
Yeah,
students,
so
please
really
listen to him. Let's listen to him and like use all the techniques that he's asking you to do, and I'm sure your proposal will come out very well.
absolutely, yes, yeah.
All the
Thank
best.
you.
All the best.
Thank
Thank you.
Thank you.
Okay,
Thank you, sir.
Thank you.